I believe we can start. Professor.
All right. Good day, everyone. Those actually in the places where it's evening, good evening. I'm delighted today to introduce a good friend, which he and I work together on a few projects. Professor Attila from Harvard University, actually, he works at the Department of Emergency Medicine. And also, he's associate professor at the Mailman School of Public Health in Columbia University. Professor Attila's interest is actually very wide, not only in information and digital health, but also he and I worked on value healthcare. It's been an experience of 30 years as director and in hospital management in many countries in our region, Saudi Arabia and UAE. Delivered many courses. The last one was a very large course on emergency preparedness and responses in Jordan. I'm delighted that he is here with us today. I don't want to take more of his time. His CV is on the web. And we give you the floor. I'm delighted to have you here in London.
Yes.
It's an honor and a privilege for us to have you with us, Professor Attila.
You're kind. Thank you so much. Well, first of all, thank you so much, Dr. Salman, for the invitation. It's my first time here actually on campus, so it's a privilege. And thank you for Celine for arranging this as well. And Rachel, thank you so much for making this all work. So today we're going to talk a little bit about resilience to climate-induced extreme weather events. And look forward to your participation, many questions, and especially for the people online, looking forward to your thoughts. I have no disclosures to make, so I just thought I'd throw that sign out. And of course, you already know where I work. I have multiple different hats. So let's talk a little bit about what we've learned from the pandemic. I would submit to you that we've actually learned very little from the pandemic. These notions of preparedness have been really significantly challenged. And what we found also is that learning has sort of stopped in terms of what has gone on in the past and where we are right now. And that's a challenge going forward. This is not new. One of my friends, Dr. Herzlinger at Harvard Business School, she wrote early on in the pandemic that hospitals were not prepared. And that, of course, was very true. In fact, where I was on January the 3rd was in Doha at a World Health Organization conference. All my friends there that were infectious disease docs, they just got notified at the time that there is a novel virus circulating in China. Everyone was concerned. Everyone was happy before, solemn faces. Everyone's now worried. Hey, what's going to happen? And when I went back to the US, I was talking to hospital systems and saying, hey, you guys need to review your plans. You need to get ready. There's a potential for a pandemic. Nobody was listening. Nobody took it for serious. They're like, oh, it's over there. We have good measures in place. This is just like SARS. It will all blow over. And so we have challenges with regards to that type of preparedness. Now we got stuck. Can you see if you can unstuck it?
Should work now.
Okay. All right. So when we're talking about the challenges related to climate induced extreme weather events, this is just a picture of last year in terms of the United States, in terms of how many events are happening. You all know I don't need to explain climate science to you in terms of the fact that this is increasingly getting worse. The duration of events are longer, they're more complicated, but they're happening everywhere. And they're really becoming billion-dollar disasters. Now, when you're thinking about this in terms of how does this relate to me, because that's how you actually bring this to reality. Last year, I'll give you an example of last year. Last year, I was here in London. Actually I was invited to speak at Oxford. Brought my whole family, and everyone was excited to get out of Florida because in Florida in the summer it's really hot. It's like in Oman. It's like 34, 35, super humid. Everyone wants to get out. So we came to London and we're thinking that it's going to be nice and cool. 25, 26, whatever, it's going to be nice. We came, unfortunately, in the hottest period of time last year in not history, but that year. It was the hottest week. And my kids were all melting in Oxford. Everyone was complaining. Everyone was like, and of course, there's no AC. So really a serious event. The year before that, I was invited, we got some funding and in Sheffield, University of Sheffield, to do, to address the extreme heat weather events in the UK. Because remember that year, it was up at 40, 41. It was really bad. Can you imagine, by the way, thinking about 40, 41, can you imagine this year for the people in India that were at 52, how unbearable those situations are? I'm not sure if any of you have been to India, but that's pretty intense in Delhi with the smog and things like that. Now, at home, this is a picture of my neighborhood. In Hurricane Milton, we had 2 back-to-back hurricanes. One was pretty devastating. You saw the damage probably on the news in terms of the east coast of Florida. And then literally 2 weeks after that, not even 14 days after that, came the next hurricane. The next hurricane wasn't as bad, but it created an event that we've never seen before in the history of Florida. And that is the spawning of more than 130 tornadoes. The tornadoes that came up before, they would always get some kind of sporadic tornadoes that would happen. None of them usually touch down, very minimal damage. We had this whole area that you can see lit up in red, tornado warnings. This is the picture of a tornado crossing one of the major highways where I live. And literally a few blocks from my house, this is what you ended up seeing. Complete devastation due to the tornadoes, not necessarily the hurricanes. So communities are now getting impacted very significantly. During that summer that we came back last summer from London and experiencing the severe heat, I thought going back home, I'm originally from Canada, thought going back home, visiting my parents, it would be nice and cool. Unfortunately, and ironically, that was also one of the hottest summers and ended up creating massive wildfires. So one of our jewels, Jasper National Park in the Rocky Mountains, burned to the ground. As we were coming home from British Columbia, where my parents live, we were dodging wildfires. There was areas that were closed down and we're going home. This makes it very real because wildfires are probably one of the most terrifying climate-driven events that you can experience. I say hurricanes are pretty stressful, but they have a beginning, they have an end. Wildfires, you don't know. And that smoke, you cannot escape. It's very, very terrifying. So we wanted to look at what our response was in terms of wildfires, and we found that we have some major problems when it comes to wildfire response globally as it relates to healthcare systems. And so we actually provided some guidance, creating a framework in terms of how healthcare systems need to prepare for wildfires. This was just published last year in Lancet Planetary Health. And it's, of course, become very, very important, especially with what we've seen now in the California wildfires, which, by the way, 100% preventable. People think, oh, wildfires are not preventable. They have wildfires in California all the time, and they also knew there's some basic things that you don't do. For example, like you don't completely drain your reservoir and start doing maintenance when you're supposed to have water in the reservoir all the time. And they didn't pre-position fire trucks. So there was a lot of a cascade of errors that occurred there as well. When you're looking at global risk and how people are now starting to think about climate change, you can start to think about this from the perspective of global leaders. They have all attributed that their number one concern, by and large, if you're looking at this graph here, is related to extreme weather. Now, all the rest of these are other papers unto themselves, but they also present a significant risk. Now, if you think about this in terms of a long-term top 10 risk for the next 5 to 10 years, it hasn't actually changed. In fact, climate action failure has become the big issue. And as you probably already seen, the United States has pulled out for the Paris Accords. And now we're going backwards because a lot of countries now, in terms of their focus on climate, is going to be reduced. And yet, as you've seen in the previous slide, it still presents the #1 risk. Look at this. If you wanted to look at it from a bar chart perspective, extreme weather is still the #1 issue. And it's going to be for some time to come. So we need to think about this from a public health perspective. How do we prepare? How do we think about things a little bit differently? And the interesting thing when you look at this is they're all interconnected. If you're thinking about the aspect of social cohesion, social political risk, cyber attacks, all these different types of things, everything is linked in some way or another. So we need to be thinking about it from that perspective as well. Now, rewind here for a little bit back to 2020, the WHO had also even thought about this and saying, hey, this is a big problem going forward. This is pre-pandemic. And look at where health and the climate debate was, right up at the top. So nothing has changed there. Of course, if they would have known, they probably would have put these two right up at the top. Now, what about education? Are we preparing healthcare leaders, the people that we expect to actually function in a crisis? Have we actually prepared them? So I was teaching class during the pandemic, and I was curious about my own students. I teach a course in our healthcare MBA program, and these are the executives that are going to be running hospitals or already running hospitals. I'm saying, how prepared are the programs in the United States that are accredited graduate programs in teaching disaster or emergency management? And we found that there were only about 18 programs that had an elective that actually taught anything with regards to climate or disaster. There's a paper that's forthcoming that we just got accepted that looked at climate education specifically, and we found a very, very, very low uptake in the United States, Canada, and Australia as it relates to climate education. So that's still a major gap. And when I asked the students, do you think that we should have some kind of emergency disaster management training in your programs? They all, pretty much 96%, believe that they should. So the students are like, hey, yeah, of course, this is probably a really good idea. We're not prepared in our organizations. No one is preparing us, and we need to be thinking about that. We have a paper under review right now where we actually reached out to CEOs and asked them about their preparedness and their experiences during COVID. And all of them admitted to one major failure. They said that none of us were prepared. We were all put into these emergency command centers and expected to run them and expected to perform and provide leadership. And none of them had done that before. So it created a great deal of stress. They all had to learn these things all over again and right from scratch. So we advocated that actually emergency and disaster management needs to be taught as a core competency. And this should be, of course, cross-disciplinary in nature. And so I looked at this, hey, is this actually happening in other programs? What about MBA programs? What about MPH programs? Again, very low penetration into MBA programs that are accredited. There's so many MBA programs out there, and yet we're not teaching leaders just in general of businesses and corporations that have MBAs in terms of crisis and leadership. Very, very, very few programs are doing that. So we really need to pivot and start to think about this differently. We need to start applying 20th century solutions to 21st century problems. And that is really important. When you're thinking about this in terms of crossing this chasm that exists as in terms of silos, and I present these as silos, we're still very siloed in our thinking. It doesn't matter where you go. I just came back from Dubai. I was teaching a course in this to the Dubai Health Authority. And their whole department is siloed. I said, why isn't all of your leadership here in the classroom we're talking about this? They're the regulator. They're the ones that are responsible for disaster and emergency management. They're not there. Half of them weren't there. I said, why isn't everyone in the whole organization in this if you're expected to do this together? No one can answer that question. So we're still seeing siloing of education in this approach that's happening. So we need to think about this differently, because we're essentially in this difficult situation of being in what we consider a perma crisis. I know it's not very encouraging, but it is sort of the truth. We are sort of essentially pivoting from one crisis to another in society. And so I thought about this and approached one of my colleagues. I work with Dr. Flavio, and he is in charge of what's called the EMT initiative at WHO, which is the emergency medical teams, which is a great resource that we're training in different countries to utilize their resources to, one, of course, support their own country's response, but also these resources now are available to be deployed to other parts of the world. So, for example, they were very, very, very involved during Gaza, and they were able to support a number of initiatives, particularly from the medical perspective. There's a lot of work to be done, a lot of work in terms of credentialing, a lot of work to be done in terms of competencies. What does it revolve to be on these teams? How do these teams get measured for their effectiveness? These are all areas that still need to be done. And the initiatives are there. But I thought about this and saying, hey, countries need to think differently outside the box. They need to think a little bit in the 21st century solutions. Leverage these teams from a countrywide perspective when you are overwhelmed. How is, for example, the WHO now working with the military? How do you leverage these resources? Because the fact of the matter is, we just don't have enough people. We don't have enough resources to be able to solve some of these issues due to these issues right here. Many healthcare providers, Dr. Salman, remember in the summer, we talked about this in terms of burnout. There's workforce shortages, and we're also starting to see the lack of institutional memory. Remember I told you that lessons learned got forgotten? Much of what happened during COVID was not codified, not written down. So it didn't persist. And so because so many people have also retired, that organizational memory is gone. So if we had another event such as a pandemic, we're destined to repeat things all over again from scratch. More resources, all those kind of things will have to be done for something that we already figured out a while back. Now, it's gotten to the point where even if you bring up a COVID discussion, people look at you like you're almost crazy. Like, why would you even talk about that? Could you imagine going to a dinner conversation and bringing up COVID? You would be like asked to leave, right? People are like, why are you talking about it? We're having a good time. Like, don't talk about that. And some people are at that point, not if you're in public health. COVID never even existed. It never happened, right? So for some people's memory, that PTSD of compartmentalizing this bad part of our lives never existed. Now, when you're looking at healthcare systems, one of the problems that I've seen with this is that many organizations have never actually done a debriefing of what happened during COVID. How do I know this? 2 years ago, just as COVID officially was over, I was asked to do some leadership training for a very large healthcare system, all their senior SVPs to help them upskill to very senior executive posts. And this very large healthcare system has 40,000 people in the system. And I was talking about this crisis leadership. And then I asked them, I said, what were their experiences and so forth? And this one table, they started crying. A couple of women started crying. It was like, oh my gosh, what happened here? So it turns out that this was the first time this group of executives in this large healthcare system, this is the first time that they've actually talked about COVID. Can you believe that? It's like, that's not my responsibility. That was not my lecture to actually debrief the executive team on what happened during COVID. And yet, this is the first time that they got an opportunity to talk about it. So some people were so overwhelmed with emotion. We were talking about like all the good things that happened. And it was interesting because people were on the other side of the room and saying, oh my gosh, you did the supply chain. If it wasn't for you, we wouldn't have been able to run this part of our hospital. And so people that didn't really interact before because it's a large healthcare system, they just knew them by email or phone or whatever. Now they're finding out what all these innovations were, all the things that happened, all the positive things. And then we also got to learn about some of the challenges. First time that happened, I was like taken back. I was like, wow, I wonder how many other healthcare systems are like this that never actually debriefed, never did after action report, and nothing ever progressed from there. I think still we're at that stage where we've never really come to terms with what happened during then, what were the lessons learned, what was codified, what we can take away from there so we don't repeat these things. Again, I think that's an opportunity that has been missed for sure. And then we're also switching into this situation here of disaster fatigue. So the paper that we wrote in the Lancet was actually dreamed up by a close friend of mine who's evacuated more times than she can count in northern Canada. And 2 years ago, she had to evacuate her whole entire hospital and the community. Now, this is no easy thing. When you have people on ventilation, you have dialysis, all these people, older patients, chronic disease, ICUs, all have to be evacuated. It's not a choice. It's not like, okay, we'll talk about it next week. We'll have a meeting. We'll discuss this. We'll plan this. Hey, that smoke is coming. The wildfire is coming. You need to evacuate now. Get on that military aircraft and get this hospital out. They had to do that. She says, wow, this was not fun. What she was concerned about, and we brought it out in our paper, is that we need to start taking care of the workforce because people that are doing this evacuation, even now in California wildfire, my friends were telling me, they need to worry about where their kids are doing. Are their kids safe? Are their families safe? Pets, all these kind of things. Because just because you have a disaster doesn't mean that life doesn't continue on, right? And we need to kind of think about that. So this disaster fatigue, people are wondering, like, I don't know if I really want to go to the next one. I don't know if this is something that is I think I need to take a time out. And we've had this. I've had so many colleagues now from an infectious disease perspective that were experts, that were the ones to respond to stuff like Ebola and things like that. 2 reasons they've stopped responding. 1, safety. People get killed now. Number 2 is they're just burnt out. And these are the top experts in responding to infectious disease outbreaks. So when these people stop responding, now you have a real problem. So these are the things that we're starting to think about. We need to think about this differently because unfortunately, these events, they don't happen in isolation. And we first kind of thought about this living in Florida, I see these things that, we get hurricanes and hurricanes don't care if there's COVID. And so we had to start thinking like, hey, what do you do when you have to manage a natural hazard like a hurricane plus COVID at the same time? And a few years ago, we also had a major incident called the Surfside condo collapse. This huge condominium on Miami Beach, it collapsed. Now, we can handle this stuff. This stuff happens, but it doesn't happen during a hurricane coming in and COVID at the same time. So resources were really, really, really stretched. So we need to kind of think about this a little bit further. So we wrote about this just recently last year and talked about hospital preparedness during hurricane seasons, plus having to think about what happens if you have a cyber attack and this hospital system goes down. How do you still provide services? Because during these events, nobody really cares about the fact that there's a hurricane. People expect certain things. First of all, they expect that there's going to be fuel, that they can drive around, at least in America. They're also going to expect that there's food. And they're also going to expect that they can get their dialysis, they can get their care that they always get, that their hospital is open, and everything is normal for them. This is just the crazy expectation that they have. They expect that these things function and will continue to function. And so you have these expectations, and if you have something called a cyber attack, this is the most opportune time to take advantage when a healthcare system is on its knees and has these types of events. So we kind of talked about that. These are the things that we are thinking about. So this requires us to think about this sort of outside the box in terms of integrated teams. Integrating teams is not new. We've been talking about this for years, but it is very challenging because we are all entrenched in our silos still today. So from a public health perspective, public health has to intentionally have a seat at the table in all of these crises, not just in a public health infectious disease type of thing, but in other events. And similarly, what we found, for example, in the California wildfires is that the hospital system was invited to the operational command center 5 days after the event. And Kaiser Permanente is the biggest healthcare system in California. and they were at the table. And this, like, why was that the case? How did this happen that people were still operating in silos when we know better? And so that sometimes healthcare systems get left out. Public health gets left out of conversations, exercises, full-scale drills, those types of things. So obviously, if you have cooperation failures, you're going to have less than ideal outcomes. What we need to be is like this. Okay, if you think about this, how long does it take for this Formula One car to get its tire changed?
8 seconds.
8 seconds. Which requires that all of these people know what? They know their roles, they know their jobs, and they're able to do what? Execute flawlessly every single time. What happens if they don't?
Falls apart.
Or they lose the race.
Yeah.
Right? Time is of the essence. So this speed of execution, the effectiveness of the execution, everybody knowing their role, practicing their role. Obviously, they practiced this many, many times before they got to the race. And this is what we're saying, is that before you get to the race, before you get to the event, you should know the person on the other side. You should have gone for lunch with them. You should have had some kind of interaction so that it's not just the first time that you're showing up and seeing them and saying, this is my counterpart that I need to deal with this major emergency, and we're going to be spending a lot of time together. You need to have worked out some of these issues, some of the potential issues, some of the issues related to communication, role responsibility, and have practiced that in depth. Unfortunately, sometimes we don't see the whole big picture. And this is an example here. This is the Boston Marathon bombing picture. And think about this in terms of your perspective. Right now, you get to see everything in terms of the explosion. But that doesn't always conform to reality in terms of what you know. You only sometimes are given this part of the picture. You don't see how many other people have been affected. And this is a gap that still exists today in terms of the way that we look at things. So I give you the paradox of the cube. What do you guys see in the box? What's in there?
Cone.
You see a cone, right? Now, of course you're like, of course it's a cone. Why would you ask a silly question like this? Of course we can see that it's a cone. But it's all a matter of perspective, right? Because if you look at it through one dimension, one side, or you look at it from the top, for example, you're probably going to see different things. If you look at people A, you'll see a triangle. Now, is that correct? It's sort of correct, right? Because from that person's perspective of the incident, let's take this as an incident, they're seeing a triangle. And so you get back information that it's absolutely, sir, it is a triangle in the box. Okay. But if someone else now takes a look at it and sees things from a different perspective, their perspective, they may see that it's a circle. And are they correct? Yes, from their perspective, it is. But they didn't get the whole picture. And yet decisions are often made in emergencies with limited information. So we encourage people to start thinking about this from the perspective of what's called meta leadership, and thinking about where the person is and how they need to lead in an organization as it relates to disasters, leading across, leading up, leading down, and leading beyond, and being kind of visionary in terms of the situation. Now, there's a little bit of a conundrum here when it comes to leadership and management of incidents. And this is why I'm talking to you and the people here on remotely, is that we are training and you guys are involved in becoming the future leaders of public health. And so hence, you guys are not just going to be in this role, the managerial role of an incident perhaps, but we're going to be looking to you for leadership and thinking outside the box. Managing to some extent is relatively straightforward because there's certain certainty, there's stability, there's predictability, whereas, and it's routine. And whereas leadership is in a whole different ballgame because there's ambiguity, there's the situation can change, there's risk associated with this. This is crisis and change. And so you have two things going on here. One is With the routine situation, time is your friend. Like a hurricane, for example. Hurricanes don't just happen overnight. We have plenty of time to prepare, evacuate, get things ready, and so forth. Wildfire, totally different situation, right? Time is not on your side at all, and you have to make decisions. Time is your enemy when you're looking at it from a leadership perspective because of these things that are going on. Now, I experienced this during COVID, and I know you did too, Dr. Solomon. We were talking to governments and telling them, at least I was, when I was looking at their plans and how they're thinking about COVID, I asked them a number of questions, and everyone had the same failure in terms of an answer. I said, what happens if your whole team gets taken out? And they're like, well, that can't happen. I'm like, yes, it can. This is COVID. This is a novel virus. We don't know. This was pre-vaccine. I said, who's going to be your next level? Many organizations in government, and these were governments that had a lot of money, they didn't have a next layer. No one was trained. So they relied on their top people to run all the decisions. Major folly, no redundancy in there at all, no thinking forward. The other issue was people were reluctant to get new people to come and say, guess what, Hamid, you're in charge tomorrow. Well, we can't put Hamid in charge. He doesn't have enough experience. Guess what? No one else does either. Put Hamid in charge. He'll figure it out. This is the time to learn. People were risk averse. They're like, oh, we can't have Hamid. What happens if he makes a mistake? Good. Everyone made a mistake in COVID. Everyone screwed it up. So the thing is that we didn't provide that training, that mentoring that was required for people to really in the next level, and not just level 2, but level 3 and 4. People weren't even thinking about that. What happens if level 2 is out? Is there anyone trained in level 3 and 4? And that was a problem that we seen quite frequently as well. So training didn't happen. Mentoring was also not there. And the other problem was people weren't thinking ahead 6 months. Because what did we all promised? That this COVID virus would be finished and everyone would be back to normal in how long? 6 months, right? And if you talk to infectious disease docs and people that were in the know, they had long ago said, how long? 3 years, right? So, and again, it was 3 years, right? So they're pretty accurate. It is definitely not 6 months. And so there was no forward thinking in many governments, number of organizations in terms of leading. So these are some of the things that we kind of talked about this before. Of course, now, like I said, addressing the urgent needs of the present is a role of management, and it requires all of these types of things in terms of taking decisive action, allocation of resources, and so forth. Leading is a little bit different. You really need to get ahead of this, ready ahead, thinking about what's going on, way ahead. People should be reading the papers that we write in Lancet and stuff like that, policymakers. Now, fortunately, they are. For example, last week I was on the phone with Government Australia. They read our paper and it says, okay, we need to become more resilient for wildfires, and how are we going to build new infrastructure for hospitals? What should we be thinking? I'm like, oh, thank God someone's actually reading this and is making policy decisions in terms of how they're building healthcare systems for the future. Now, that's good. That's where we want people to be in terms of thinking about that. And that's leadership. That's thinking out ahead and saying, hey, if these things are going to be a problem, how do we become more resilient? How do we adjust our workforce? How do we adjust our infrastructure and all those kind of things? And so we need to be more transformational in terms of how we're thinking about this. And I would submit that we're still not quite there yet. Everyone's still kind of thinking and being reactionary rather than planning forward. So we find that many of these crises are what we call overmanaged and underled. True leaders are needed to actually think ahead, be decisive, be bold, and saying, hey, this is how we need to resource. This is how we need to train. I am really personally, from an expert perspective here, very concerned that we will not be able to mobilize for our next major global crisis the number of people that we need, because they're burnt out, they're tired. Our healthcare system is already stretched in every country that you go to. And where are you going to get the people to step up? Where are we going to rely on? We have to rely on teams like the WHO, but they're also limited, and they're going to first respond to their own country and then the military. And again, those conversations are not being had. And so the whole notion of disaster and emergency management is designed to do this, is you have a chaotic situation. This is why we train people to be able to essentially take emergency management complex and use that as a solution or as a way to organize the chaos. That doesn't mean that there isn't chaos, it's just more organized. So what is the goal? So our goal is to prevent a future outbreak from becoming a pandemic. And to really think about this, the world needs to do better in terms of hospital preparedness, training, and more training is required. So if you gave me a pot of money and say, where should you deploy your money? Of course, public health surveillance, AI, we haven't even talked about this, is a different lecture that I'm doing. AI integration into public health, particularly disease surveillance, is a game changer, completely. But hospital preparedness is one that we still need to do quite a bit more work on in terms of our training and making sure that everyone knows what their roles and responsibilities are to be able to address multiple things happening at the same time. Very few organizations, when I've talked to them and I pose this question, how do you deal with multiple things happening at the same time at different sites? It really overwhelms their thinking. They're like, well, you're thinking way too outside the box. I'm like, no, I'm not. I'm saying, have you thought about this? Because what happens if there's two things that happen? Well, that would really stretch our resources. Okay, I'm going to put one more in there. Well, then that's a calamity. I'm like, yeah, but this is your job. Like, you can't say this is now someone else's job. This is your job. You have to plan for this. You have to train for this, and you have to get things ready for this. So that's what we need to think about. Because here's some things to think about. We already wrote a paper about this 2 years ago. Is it 2 years ago? Yeah, time flies. That we are not prepared for the next pandemic, that we didn't learn enough, and that we need to be really mindful of that. Now, here's an interesting thing, Doctor, and I'm interested to hear your comments. I have one more slide to go in terms of why this is. Why is this not being discussed in the literature the way that it needs to be? The literature is essentially silent on this. Did you know that when COVID happened, there was stuff in the literature for years that said, hey, we're not ready. We need to do better. We need to get ready for this because it could be really, really bad. Silence, like deafening silence in the community. There's some real risks ahead. Now think about this from a public health perspective. If you get a novel virus with an R0 like measles or mumps, a low K factor like COVID, and you have a CFR of Ebola or rabies, this is existential threat to humankind, right? And to think that, well, we can contain this. There's two great movies I make my students watch all the time. One is Contagion, to see how people react. Okay, what are people going to do? Because I don't think that we've also got that part figured out, right? Because trust in government is eroded. So what are people going to do? I think a lot more practitioners and providers that are of the millennial generation, they're going to think twice whether I want to go into this healthcare organization and deal with all this craziness, or am I going to choose my family? Contagion is a really good movie to watch when it comes to that. What happens? What are people going to choose? And then there was another movie with Brad Pitt, it was back in the 90s, but it just kind of gives you an idea of what can happen. That was called 12 Monkeys. Anyone see that movie?
Yeah.
If you no, that's your homework for today. Go watch 12 Monkeys. It's a great movie with Brad Pitt, but it just shows you how a virus can go around the world like this. Super easy. This whole idea of containment in this modern era is fallacy. You can't contain anything. Everything is open. Everything is going to move at light speed. And I think that's the issue that we really need to think about going forward, is that this can be an existential crisis, and we need to prepare accordingly. So, questions?
Thank you. Thank you very much. Precisely on time, you gave us an extra 1 minute. Do you have anything from the floor here, and before we go to colleagues online?
Any questions?
It was very interesting. We didn't feel the time.
I mean, I like your example of the Ferrari, racing car. It's not only actually training the people and understanding the task, but also the design.
Yes.
You see the car designed in a way that changing of the car or even any part in that car could be done in a second.
Yes.
So we need to remember that, I mean, if I have my ordinary Ferrari, I don't think they will be able to change it in the same speed.
True.
So how do you say about the design?
So the thing is, that's very true. Like, when you're flying in a plane, just don't fly to Washington. It's a very sensitive subject right now with the crash. But, we take things for granted from this perspective. When you get on the plane, you trust that this metal tube that we're in and going across thousands of kilometers, that those people in there are going to get you from this place to that place safely, right? How do you know this? Because we go to sleep, we don't worry about it. You look out the window, it's normal. Even when there's some bumps, you're like, okay, everything's going to be fine, especially if you've flown a lot, right? We take this 100% granted. Why? Because we know that those people that are behind those controls, they've spent thousands of hours rehearsing for every kind of emergency, contingency, and they know their information cold. We have 100% explicit trust in that, right? Plus the technology. So we have 100% trust. I think we need to get to that point in terms of the realism of our exercises. The full-scale functional exercises are completely different than if we did a tabletop.
Yeah.
If I get you into level A suits and start simulating what a CBRNE event is, chemical, biological, radiological, or nuclear event, that type of thing, and you're sweating, and you have to make decisions while you're sweating, while you are stressed, while things are going on, while people are dying. We can do that, by the way. Our simulations now are really good, really good. And government needs to be spending more money on these realistic simulations using VR in the metaverse, things like this. This is where things are going to bring down costs, to bring down and to get more inclusivity of people being able to practice. This is how you're going to get really good at it. So when you do have an event, the operational readiness, people are ready. They know how to respond. They know what their roles are. They don't go into situations saying, oh, I don't know, what am I supposed to do? Or they don't let the half of the city burn down. Like in California, this is unacceptable, by the way. It's just not the accountability, everybody should be fired, because that's just unacceptable to have such massive loss. Could you imagine if we had an event and people didn't know their roles?
Especially it's happening almost every year.
Yes.
So what's happened?
Again,
that I want the next question. So what's happened? I mean, people are trained, prepared. USA, they have fantastic resources.
Yes.
California in particular could be one of the richest countries in the world if it's independent. So what's happened?
So two things have happened. One is lack of accountability. So years back, when people did kind of mistakes, they got fired. So think about this. When you're looking at even California, the mayor and the fire chief, they were making excuses. Any other person that was in charge, they would have fired them on the spot. What do you mean you let this whole place burn down? Like giving excuses. So there's accountability is one piece. Still to this day, for example, for COVID in the United States, because it's political, we have not had an investigation in terms of what really happened like they did in the UK. Remember the UK, the Lancet report that came out was damning. It was really, hey, we didn't do a good job and we really screwed up and we need to do better. So it was like that.
Public inquiry.
Public inquiry. Still have not happened in the United States. Many other countries also swept it under the rug. So accountability is lost. The other piece that's not happening is the level of training and sophistication is not there. So if you're in one part of the country, you can maybe get better response, better coordination, all those kind of things than another because of money, number one. And number two, many countries don't have a national response framework or a training institution that's national level. right?
I mean, national level, you're talking about the entire USA or California?
The entire country.
Okay.
And so so I'll give you an example. So during 9/11, not during that, after 9/11, money flowed like crazy out of the government. And literally everybody was trained across the country like mad for years. There was so much money flowing and there was so much training going on, everyone got trained. So I knew, because I attended class with the people. We went to learn how, we did radiological training. Then we did VX training on how to deal with chemical attacks in the suits, all that kind of stuff, all that stuff. Then we did training on bombs. So I learned how C4 works. I learned how to make C4. I learned how to make ammonium nitrate. I saw what happens when you blow up a dummy with this. Everything there is to know about explosives. Everybody was trained on every kind of hazard, fire hazard, all these different hazards. So you knew that if you responded to California and you came from Florida, your counterpart that you're talking to, you knew they were trained within the past 3-4 years, the same level you were. Now, I can go to the other part of the country and I have no idea what you did. Maybe you're brand new. This is your first disaster. You've never been there before and you don't know anything. And that's who I have to deal with. So you have this whole countrywide response that's all over the place in terms of training, experience, any of that kind of stuff. So you can't have a good response from a big perspective if you don't have the people trained. Everyone has to be on the same level.
So we know why they removed Saddam Hussein. It's cheaper. The fear. Anyway.
But I have a question.
Yes.
So we talk a lot about the mistrust that's happening from people, patients, whatever you want to call them. So what should we do? So I'm going to ask the question to you. What are you doing to gain that trust back? From your expertise, you've published a lot.
Right.
Your bio comes before you and you're famous all over, but what are we doing to gain that trust back?
So I think that a lot of this is transparency and getting out there and talking to people where people are consuming that. They're not doing that on the mainstream media. In fact, it's interesting you brought this up because I had the same question and the same response to the Dubai Health Authority. I was just doing some training with them 2 weeks ago, and that's what they need to do. These public campaigns that have to happen where you are getting transparent and you're getting to where the people are. People are not consuming news on traditional, they're doing podcasts. And the podcasts have got more traction because they're the sense of authority people are listening to it must be more accurate because you can be yourself, right? You don't have to give government speak. So that's one of the big ones. And the campaigns, right? 10 years ago here in London, there was a campaign to increase the number of people that were trained in CPR and in automatic external defibrillators. So what happened here? The NHS partnered with London Ambulance Service, and you saw on the billboards everywhere all these things about CPR, what you needed to do, AEDs. They had all of it everywhere. It was on the tube, it was on the roadway, it was when you got to Heathrow. Everywhere they had this thing. It didn't happen for 2 months, not 1 month. It was for a whole year, and it made an appreciable difference in terms of London City's population preparedness for CPR and how to do AEDs. And it's gotten to the point where laypersons before, they eliminated this distrust. Why? Because in the old days, we had to open the mouth, breathe, start chest compressions. People like, I don't want to do that. I don't want to breathe in anybody. You can die. Like, just people would not do that. Now we know layperson, all you have to do is compressions. You don't even need to do ventilation. That's changed the outcome and the trajectory of return of spontaneous circulation of patients that end up with heart attacks. So if you're targeting this can also make a major difference in terms of improving that trust. But we need to do that now, not later, because that trust has eroded and it's a significant barrier to implementation. Because I think trying to do vaccines in the next go round is a nightmare.
Especially with JFK taking over.
I guarantee you that if you told people that there's bird flu and you're going to die literally tomorrow, I think half the people are going to die. That's how we're modeling now, by the way, truth.
You have any question
I have a
online?
question from someone from Italy,
Sure.
Rosanna, public health specialist. She's asking how to prepare for the next pandemic when the budgets for the health sector are reduced and with a workforce that has not recovered yet. In Italy, there has been no recovery phase after COVID.
Yes, so that is the issue. I think that this is now a leadership question. Relying in some governments on the federal government to make the changes is not necessarily realistic. You have to start as a leader making those changes within your own organization and empowering others to also have a voice in this. You absolutely need to have funding. There's a paper, by the way, that's another paper we did talk about after, that we are discussing about the fact that we absolutely must have funding from the federal government for this hospital preparedness, because the hospitals are so underfunded already. Then you add and layer in this need for now responding to cyber attacks, to disasters and things like that, and it's just not there. The money is not there for training. You said you want me to shut down this aspect of my services to get people trained. Where I don't have the bandwidth, and so funding needs to be there. There needs to be advocating for funding at the national level to be able to do that. It's not an overnight fix either, but leadership, the people that are trained in this area, people that are taking this serious in public health have to raise the alarm that this is a problem and we need to actually train for this. And it's really important to do so before we have the next event.
So I think within the health sector, then it would be just doing some reports maybe of certain things.
Reports, but getting out to the people that are consuming this, right? To the media and saying, hey, this is happening. People are not prepared. Again, there was so many articles that were pre-pandemic that were written and it just ignored. People like, oh, okay, so one day it's going to get really bad. Okay, but it's not today, so I don't need to worry about it. Well, that's not true. Like, you do need to worry about it. And as a government, you're responsible for getting ready. So accountability.
I think we have a problem because you mentioned podcasts. So we have Joe Rogan in our face everywhere. On any social media platform, you have Joe Rogan, a few others. But we don't have public health professionals doing that same thing. So it's just what you mentioned, is going to the streets, start yelling.
So interestingly that you brought that up. In my class the other day, we were talking about this, and I had two students. We were talking actually about health insurance in America and how complicated it is. And two students were they knew about health insurance because that's the organized, that's where they were working. And they got so passionate about it. And I said to them, I said, you know what? We have entrepreneur sites called Startup. I said, you guys need to start up a podcast. You know what they did immediately? Then they started emailing me and saying, can you hook me up? We want to do a podcast. So they're going to start their podcast business, doing their own, these three women, they're going to do a podcast on how to navigate the health insurance. And this is how it starts, right? You need people to take this on and start making podcasts where people are going to start listening. You know what? You brought up Joe Rogan. I know it sounds crazy. It doesn't matter what politics you're on. He's got millions of people get onto his podcast because lots of people go on it. It doesn't matter what side they're on in terms of politics, because that's what people listen to. Yeah.
Any other question online?
No. Go ahead.
Well, I think like you said, I think the best way to get people like traction behind everything is to make it directly relatable for your everyday person.
Yes.
And I feel like a lot of people just don't know how bad the situation really is, especially with like global warming and climate change. Like when I talk to my friends or my family, they have no idea that we're like currently living through like the 6th mass extinction event, and it's like on trajectory to be the worst one by far. Like the world is warming and has been warming since the 1900s, faster than the Permian Triassic, which was worse than what killed the dinosaurs. And we're losing like 4 to 8 species every hour. That's ridiculous. You know, people like they say like extinction happens and it's normal, but we're seeing like 60% of all like vertebrates, I think, are like gone since the 1900s, and like 70 to 80% of like all marine vertebrates as well. So I feel like it's like how do you think we should like get like just spread that knowledge, because I feel like it's not really being pushed that much, and so people think like, oh yeah, we know climate change is a thing, but it's like, oh, it's so distant in the future, but it's like happening right now, and it's like causing all these like massive events like you're talking about.
So I'll give you an example of this, of how you need to do this. You need to get into government. So a dear friend of mine, where we wrote the paper on planetary health, she just graduated from Oxford. She's a Canadian physician. She came here to Oxford to the Bloven School of Government to learn how to talk to government. She says, we're talking about climate for years now. She's like old school. She's been doing climate change and climate and health for 10 years. She says, no one listens. She says, I need to get to the people that are decision makers. I think she'll end up being our next health minister in Canada. But she says the only way to make the difference is you need to talk to politicians, because politicians are clueless. They don't know anything about this. And you need to talk to them in their language with an authority person that can actually get that message across. So you need to be in government. Yeah, that's where it happens. That's one aspect. I mean, there's others, but if you can have, like, that's why some of the things happened in the Biden administration in terms of climate, because there were people in government that could actually fund it, turn the wheels of government to make this an actionable policy issue. And that's the key to doing that. Now, I think there's still opportunity to do that here, but that's really the key, is to be able to educate our legislators and our politicians that this is a serious issue and we need to continue to do that. Because let's face it, there's other issues that are going on that are going to crowd out this message, and people are just going to tune it out and they're going to go on to the next best thing. And that's a challenge.
So I was living in New Zealand when we had the Christchurch earthquake, and I was working in a hospital. And at the time, we then every department had to do a disaster risk plan management for every disaster, because we were on a fault line and
Yes.
all of them. So we sat there and we did it. And so for each disaster, there was a folder, and it just had the plan written out. If this happens, you do this in a particular order. And so anybody could go and get the folder for that department and go through, it's a tornado, it's a cyclone, it's a volcanic eruption, it's an earthquake, and work it out. So, and just follow the instructions that were worked out by people and experts when you weren't in a crisis situation. So yeah, that was.
But this is where it needs to be continuously practiced. Take out that folder and do that.
Yeah.
Now, hopefully they've moved beyond the folders to technology.
Yeah.
And that's the other piece that's missing here. So when you're thinking about other opportunities, is the integration of technology, which is a different lecture that I do. That is an area that here is going to make a major difference in terms of our preparedness. Resiliency is the use of technology, particularly AI and prediction.
I think that any other questions, but then my final question would be, what are we gonna do during Trump's presidency over the next 4 years? What are you gonna be doing?
In terms of?
Climate change?
So in terms of climate change, it's a very interesting question that you asked. So I talked to a dear friend of mine at Sea Change at Harvard, and we were debating this question, like, what do we do? So there's three options that you can do. A, you can do nothing. B, so you wait it out. B, you do something and say, you know, this is what we need to do. Or you put your head down and you do a lot of research in the next 4 years. So we were kind of toying with the idea of that we would put our head down and do a lot of publications and do a lot of research. Of course, we're not going to abdicate from saying things, but I think because remember, when I talked about soft money in the beginning of the presentation, we have to be extremely careful that we don't make a lot of people upset and we don't get funded, because then we're out of jobs. So I think we can still move forward and do a lot of good things, because we need to do still a lot of science and a lot of hard work in this area, because you're still going to need to train. And the other thing that we kind of thought about is that we need to maybe change the word climate, because that doesn't really work well with sometimes you just need to understand how government works and what's politically acceptable and what's not. And so that's what we're trying to do, is maybe soften it to hazards, other types of things. But internally, we know what that means. And so I think the agenda still progresses, but under different terms, because that's what people are doing. They just have to use different terms.
Option D, you didn't mention, wait for 4 years and continue praying.
We're doing that anyways.
On this note, thank you very much.
Thank you so much.
Thank you
Appreciate
very
it.
much
Thank you.
indeed.
Yes,
Lovely. It's great
Thank you
to
everyone
see you
online,
very much.
and we'll see you guys soon. Thank you.
Mm.